and she's worried about is her baby going to be born healthy? Is the baby going to need treatment? And so that neonatal consultation is such an important step in establishing initial trust and helping to alleviate her fears. And one of the important parts of that process is that over the years, our neonatology clinic has developed a notebook that was developed by moms who have been through this process, who said this is what moms in this situation need to know. Pregnant women with a history of opiate dependence need to know that their baby's going to be okay. And so there are stories in there from moms telling their own stories. And then there's also key information that they're going to need. And so every woman that comes in for that neonatal consult prenatally will get a copy of that Our Care notebook. So some of the things that we're looking at when we come together on that monthly basis and we're talking about our prenatal patients, the things that we're looking at as a collaborative, and all of the team members are weighing in on this, are what are the positives, and then what are the things we're concerned about. And we've identified over the years the key things that are going to be indicators about how a woman's doing in her pregnancy and the prospects for her having a safe and healthy delivery. So is she attending her prenatal appointments? That might seem really basic, but it's so important. And research has shown us that early engagement and regular attendance at prenatal appointments can have a positive outcome on the birth weight of the baby and is critical to the overall health of the baby. Certainly participation in substance abuse counseling and in their medicated assisted treatment. So if they're not coming in for their medicated assisted treatment or they're not complying with the requirements of that, we know that that's an indicator of a problem. And we look at progress in recovery. We look at what else is going on in the home environment that might be an indicator of concern or a positive. And with that, of course, we're brainstorming, how to re-engage a woman in coming in for her prenatal appointment if she's been missing. We set up a plan for contacting her, who's had the most recent contact and can reach out to her, and set up a plan for making sure that we do our best to re-engage that woman in participation in the project. If she's continuing to use non-prescribed medication in her third trimester, we talk about making a report to child welfare and